Not just cabinets, they've got flooring too. Just about any room in the house they can take care of you. BroughtonCabinets.com is a website over there. 806, Need to Know Morning Show on AM 1100 The Flag. Kevin, you know what I would say to you right now?
Doctor, give me the news.
Something like that.
The doctor is in. Yes, indeed. Our friend Dr. Chad Zimmerman from the Clinic Family Health and Sports Chiropractic is here for his monthly visit with us. And Dr. Chad, I'm thinking a lot of people are needing you guys these days. Remember a couple of weeks ago, we had that freezing rain and drizzle, and there were people slipping and falling on ice all over the place.
Hello.
Kev missed a day because he took a tumble. Down. Yep. It's that time of year, and snow blowing, shoveling. There's just so much that can happen this time of year. I'm guessing it's been fairly busy at the shop.
Actually, it's been quite busy. Yeah. Phone's been ringing off the hook. Yeah,
I guess bad news, but someone's got to take care of them, right? So
that's right. If you want to get better quick, that's why people give us a call.
Yes. Want to talk a little bit today about something I heard a term for not long ago, and I think you've mentioned it before, decompression machines. Someone asked me, have you ever been on a decompression machine? I said, I don't know. I don't think so. But what is a decompression machine? How can it help us with some of the things that ail us?
A decompression, it's kind of our magic bullet, to be honest with you. Lower back pain in particular is very troublesome because we have so much weight pushing down on vulnerable structures like discs and joints. And if you have a history of back pain, over time it tends to get more frequent, it tends to get worse or feel worse. And then the things that you do typically to try to get it feeling better all of a sudden stop working. And a lot of times people think, well, I'm just getting older,
right.
And they kind of just accept it, give themselves that excuse, and don't really look for anything else. And what we find, especially with people that have tried other things, is that we put them on this decompression table, and what it does is it stretches. It stretches things you can't stretch on your own, and it helps to create mobility around those joints. It helps get fluid and nutrients into those discs. And you take people that have suffered with chronic lower back issues for many years, and sometimes in as early as just one or two treatments on there, it's a whole new person.
No kidding.
Yeah, it's
so
absolutely amazing.
Is that like an inversion table?
Yeah,
same
what
kind of
is this thing?
invert. You're using the same principles, right? You're trying to distract or stretch things because it's gravity that's pushing down against things every day. And so it's a similar concept, but there's a lot more control involved with it. So you can control angles, you can control the amount of poundage, you can control and really the magic is that it kind of goes on and off and on and off. And when it's done in that way, you get the benefit effect of creating negative pressures inside the spine, such as the discs and the joints, and that helps get fluid and nutrients in there. And once the discs and the joints have what they need, they can actually start to repair. And so you can use this for chronic lower back issues such as disc problems, disc degeneration, arthritis, all those kinds of things can benefit tremendously from it. And what alarms me is that most people have never heard of it, just like you.
Yeah.
We had a neurosurgeon in our office the other day, and he'd never heard of it. Decompression means something completely different to him.
Oh. Right, yeah.
And there's just a handful of these machines in the entire state. And so it kind of flies under the radar. People don't know it's there. But once they discover it, it's oftentimes kind of that magic bullet that gets them to a level that they haven't seen in years.
I've had a journey through this topic. First, it started with the gravity boots. Remember the gravity boots thing?
Oh, yeah.
And you'd have to pull yourself up and hook them on and hang upside down. And then they made the tables, but my ankles, my ankles and knees did not like hanging by my ankles. But I found a chair that I strap into, and it's got an arched back on it, and it rolls you back. And I just lay on that thing and just roll side to side, and it's night and day when I get off that thing if my lower back's sore.
Right, and to contrast versus those kind of home remedies.
Right.
Something like this is about 10 times better. You can actually get to a point where the back pain that, when you're doing something like that, typically what you hear from folks is that, it makes me feel better. It lasts a couple days, and then I'm kind of back to where it was.
That's the truth.
Kevin.
Whereas you can get people to go maybe a month, 2 months, or longer without feeling anything.
Sold.
No kidding.
Yeah.
So how about people? So here's what you hear some people say. Like, it runs in my family. There's not much I can do about it. Yeah, dad had it, granddad had it. I'm just going to have a bad back. I bet you hear that a lot too.
I hear it a lot. It kind of makes my stomach turn a little every time I hear it because it's a disempowering kind of mindset. Okay. Yes, things run in the family, but it doesn't necessarily mean that you can't be helped. Okay. And I think what happens to a lot of people is they try a lot of different things, and because those things don't work, they lose hope, and they just kind of give up with it. But you take, 90% of those people, yet you do this other kind of treatment with it, and all of a sudden they're better than they felt in 10 or 20 years. You can take people, you can perform chiropractic manipulation, you can do rehabilitation. You're going to get people to a certain point. You incorporate this new technology, and it's completely different. You get people to a much higher level of function.
I'm so glad that you're doing what you are doing, because how long you been coming in here? Like a year or so?
Yep.
Like once a month for about a year? Yep. My opinion and my understanding of what can be done through chiropractic care is so different than it used to be because of your visits. And I'm so glad you're doing what you're doing, because you know what your industry is not good at? Doing what you're doing. Telling the story. Because we think, I got a bad back or whatever, I'm going to need drugs. I'm going to need a shot. I'm going to need to go to the doctor. I'm going to need surgery. And nobody ever told us growing up that you just adjust, get the pieces pulled and twisted and turned and hands-on therapy, and that can fix so many of these problems. But nobody tells us that. And apart from some people like you who are kind of forward thinkers, out-of-the-box thinkers, we just don't hear that. The National Chiropractors Association of America should be doing TV ads during the Super Bowl and things like that, so we know, because we don't think of what you're talking about. A lot of things, I've been hearing you for a year now say what you're doing, and you'll come in and say different things, and I'm go like, oh, yeah, that makes sense too. So I'm glad you're doing what you're doing.
Well, thank you. I mean, it takes a little bit to put yourself out there and to want to explain these things, but that was me. The people that I'm trying, you folks out there that have back pain that doesn't want to go away, okay, you're who I'm trying to speak with, because that was me. I hurt my back when I was 16, and it was never the same. And I kind of went through what I call the rabbit hole, where you're going from one specialty to another, desperately trying to find something that'll work so that you can do the things that you want to do. And I remember probably 10 years ago, I could hardly move. I couldn't sit for 5 minutes. I didn't know if I could continue to practice anymore. Yeah. And so I started doing the decompression treatment, and it was night and day. I literally got to points and days where I had no pain at all. It had been the best I'd felt in 15 or 20 years. So, and I see that in the clients that come in. Yeah. You get to a higher level of function and less pain, and now you feel like you can go out and run laps again. And it's amazing.
If you've had back pain and you get rid of it, it literally, you feel like you're a brand new person. You're born all over again. What is the success rate for that, do you think? If you have 100 people that come in and go through the decompression machine, how many of them after that will say, wow, that was amazing. It worked for me. I felt better, and not just for 10 minutes, but it feels better long term. How many people would you guess?
The statistics that we see in terms of complete remission is about 76%.
Is that
so no pain at all, 76%. You have another, say, 21% that have a moderate amount of reduction. Yeah. And then you have about 3% of people that don't change.
Yeah. 3 out of 100. Yeah. That's worth a shot, right?
Right.
And that's the thing to think about here. If there was a way to feel better than you do that was available to you, why would you not do it? Right? I mean, especially back pain. It bothers you every second of the day. And you hear Chad say it all the time. The problems will only get worse. It's not going to get better just by ignoring it. And the solution might be just a phone call away. Steve has got a question. Steve is joining us on the phone lines here this morning. Got a question for Dr. Chad. Steve, what's up?
No, just a quick comment.
Yes.
My brother injured his back in college. Just a weird thing, and basically had a sore chronic back for years, to the point where it was debilitating at times. I mean, literally taken to the hospital by ambulance because his wife couldn't get him off the floor. That's how bad his lower back was, and had it treated for years. He finally found a chiropractor, I don't know which one, it was in Minneapolis, that had a combination of physical therapy and this decompression. And the physical therapist that started working on his lower back initially was bringing the other physical therapists in because he'd never seen a back that messed up.
Oh.
But they worked on it for like 10 days and got it, the muscles to the point where it allowed the spine to move some. Did I don't know how many treatments with that decompression machine, and that was about 14 years ago, and he's never had lower back pain again.
Oh, my
it was
gosh.
just night and day.
Wow. Steve,
There
thank
you
you
go.
for calling.
Really
What a great story.
Yeah, that's a phenomenal story, and the great thing is it's very common to hear that. If you do the right things, back pain will get better. But if we don't do the right things, it doesn't, and it just gets worse, and it ends up just like that gentleman's brother. So,
All right, so that's why we love having Dr. Chad in there. We're talking about making your life better. What could be more fun than that? If you want to find out more about them, just give them a call. I'll give you the phone number here. It's 492-0696. 492-0696. It's a 701 number. And Chad, what's your website?
the easiest way to find us is to go to theclinicnow.com. And that'll direct you right to our website.
Perfect. Or call them at 492-0696. Chad, thanks for coming in. Always great to see you. Keep up the good work, man.
Yeah, thanks. Have a happy happy Valentine's Day, everybody.
There you go.
Yeah, don't go to Thanksgiving yet.
Nope. All right, that's Dr. Chad Zimmerman from the Clinic Family Health and Sports Chiropractic. Coming up, Pat Traynor, Executive Director, Dakota Medical Foundation, and he's going to give us the lowdown from kind of a front row perspective